Hi, I'm Dr. Ben Newman, and I study coronaviruses for a living. Our next question is from Rick, who we know. Yeah, how you doing? Okay, yeah, the question is SARS-CoV-2 treatment in pill form? What? Yeah. Have I had a chance to look at this, and what are my thoughts? Yeah, okay, and there's a link to a story, and the story is about a new treatment called molnupiravir, and that's a whole lot like a lot of other treatments. So, if you go back a ways, how is it that we fight viruses? And the way we fight almost every virus in terms of antivirals is to make something that looks like a nucleotide. At least that's how we fight the part of the virus called the polymerase, which does the copying of the virus and is really essential, like, bedrock essential for the virus replication cycle. And so take a virus like HIV. We throw a bunch of different nucleotides. AZT is one, DDI, DDC. Yeah, definitely. All similar to nucleotides, but a little bit different, a little bit tweaked in a way that the virus is basically dumb enough to pick these broken nucleotides up and put them in, and then bad things happen to the virus after that. There are a couple ways that bad things happen. You can put in some that will just stop the chain that the virus was making, and a lot of viruses can't go back and proofread and chop that out again, so they're just dead. And others will just put in kind of a random nucleotide that doesn't match any of the other ones. And so when the virus comes to copy that again, or when the cell's trying to read that to make a protein, it just treats it as if it is a random nucleotide at that position. And so it's basically a mutation that just keeps on mutating. So that's pretty good. With other RNA viruses, these are also what we use. So remdesivir, you probably heard of, similar idea. Looks like a nucleotide. Virus is dumb enough to pick this thing up, whereas your cells are smart enough to avoid it. And so boom, yeah, you just beat on the virus. You stop it from copying itself over and over. The drugs that we would normally take to fight off chickenpox or any other herpes virus, like acyclovir, ganciclovir, valacyclovir. Yeah, all these things are just slightly broken nucleotides. And there are a couple older ones, favipiravir and ribavirin. Again, just a little bit beat up, broken versions of nucleotides that work really well against a broad range of viruses. And so, yeah, I like seeing these. And shoot, we've even published some of these with my good colleague, Dr. Cobb, little spirocyclic nucleosides. They are a good way to basically trick viruses into beating themselves up. And viruses are real fast and real dumb. And so this is a thing that can work. Now, what are my thoughts as for how well this will work? It'll probably, best case scenario is that it probably works about as well as the other ones. Drugs like remdesivir are really awesome at stopping the virus from replicating. Thing is, they are not something that you would necessarily want to take every day. I think the side effects would be there, and it would be expensive, and I don't know, you'd run some risk of potentially liver damage, something like that. I think if you did it every single day, just as a preventative kind of measure. Yeah, for treatment, if you can get the pill in there early enough, like before you have symptoms or just as soon as you have symptoms, I think there's a pretty good chance that you're going to see an improvement in the long-term outcome. People like clearing the virus faster and being less likely to go into situations where they would have severe COVID-19. So these are all good things to take like the day you test positive, especially if you're not already symptomatic. And you can take them after. It's just that they do less good the further you are into the infection, and by the time where the disease has really kicked in and is being driven by the immune system, antiviral drugs like this don't seem to help much at all. And that's true for these true antivirals, is what I would call these, and that's also true for the antibody therapies, which are also targeted at just shutting the virus down from being able to grow. At that point, it's an immune system problem, not a virus growing problem. But yeah, cool to see more options out there. So I think we've got a couple things that beat up the virus polymerase. I would like to see some better options for shutting down the virus protease, and I'd really like to see some options for shutting down the virus methyltransferases and the great big helicase this virus has. if there's a way to specifically hit those that doesn't hit similar enzymes that are in the cell, that'd be awesome, and I would be for it. Yeah, very much for it. So there you go. That's as far as I know about this one, and as far as I've thought about this one. Yeah, looks promising, and I think it'll have a limited window of effectiveness, but anything that helps is okay in my book. Yeah, so thanks very much. Great question, and I learned something once again today. Always like those. Thanks very much. This has been Ask Dr. Ben.